Welcome back to the lecture of normal growth, development, and puberty in children and adolescents. I'm Dr. Amel Elfaramawy, Professor of Pediatrics. In the last segment of this lecture, I will focus on complex skills of development that requires actually multiple other skills: motor, sensory, language, neurological, as well as social skills. And at the end, you will know how to assess puberty and the alarming signs regarding puberty monitoring. The first complex skill that you should know is toilet training, which is a developmental milestone that's usually challenging to parents and children. Initially voiding is a spinal cord reflex. Most children are ready for toilet training between 24 to 30 months of age. During that time, the capacity of the bladder increases and higher signals from the brain develop. The control occurs first for the bowel at night time and lastly for the urine at night time. Toilet training is influenced by physiological, psychological, as well as socio-cultural factors. Dressing skills are another skills that enable the child to function independently. It depends to large extent on the willingness of the parents to let the child practice. It starts with just holding out arms and legs while being dressed at the age of 1 year to be able to dress self completely at the age of 5 to 6 years. You can notice that zippers are much easier for kids than buttons, and this should be considered in designing clothes for kids. Feeding skills are the third complex milestones of development that depend on the parents' willingness to let the child practice with toleration of all the mess. At birth, feeding depends on rooting, suckling, swallowing, neonatal reflexes. Important milestones in the way are to hold a bottle at the age of 6 months, to hold finger food at the age of 11 months, hold a cup at 12 months of age. By the age of 4 years, the child should be able to feed self-independently. Hearing and vision are important senses that allow the child to develop properly. That's why they should be screened at birth. Hearing is very well developed at birth. Infants can hear as well as adults from the start. Hearing is tested by placing headphones over the infant's ears and electrodes on the head. Standard sounds are played and the transmission of impulses to the brain is documented. If abnormal, a further evaluation is indicated using evoked response technology of sound transmission. In case of delayed speech or any concern regarding hearing ability, assessment of hearing should be done and intervention should be early or the child will be deaf-mute. Vision is the least developed sense at birth, as visual acuity, color discrimination, and the ability to track objects are limited. Only light perception at birth, recognition of the mother at 4 to 6 weeks, being able to follow objects at 1 to 3 months of age, till the infant is able to reach objects using vision by the age of 3 to 4 months. Evaluation of vision and ocular movement is very important to prevent the serious outcome of strabismus. The cover test and light reflex should be performed at early health maintenance visits. Interventions after the age of 2 years decrease the chance of preserving binocular vision or normal visual acuity. You have to be aware of the red flags or alarming signs that you may find during developmental surveillance. If there is loss of developmental skills at any age, if the child, for example, was able to walk and now he cannot walk, or was able to say words and now he cannot do this, this is serious. If there is inability to walk from the start by the age of 18 months, if there is no speech, the child cannot say any word by the age of 18 months, if there is asymmetry of movements, if the movement of the right side is different than the movement of the left side, if there is complex disability, which is multiple deficits, for example, there is delayed speech plus inability to walk, or inability to focus on objects and delayed speech. If there is any concerns regarding vision, fixation on objects or following objects. If there is hearing defect at any age, all these situations are serious and warrant investigations. Now we came to assessment of pubertal stages. Tanner staging is the most frequently utilized staging system for assessment of puberty. In boys, Tanner staging includes the development of external genitalia, the testicular size measured by archidometer, and the size of the penis and pubic hair. There are 5 stages of puberty. Stage 1 is the prepubertal stage, when the testicular volume is less than 4 milliliter and the penis is small and there is no pubic hair or axillary hair. In Tanner 2, the testicular volume is more than 4 milliliter and there is sparse pubic hair. This is the beginning of puberty. Then stages advanced up to stage 5, in which the penis is of adult size, testicular volume is 25 milliliter, and the scrotum is large with dark skin. Pubic hair is coarse, curly, extends to thighs, and showed male distribution. In girls, Tanner staging includes assessment of breast development and the appearance of pubic hair. In stage 1, which is a prepubertal stage, there is no pubic hair or axillary hair and no breast tissue. In Tanner 2, there is increased size of the areola, elevation of the nipple, and palpable breast tissue. In addition to the presence of sparse pubic hair. This is Tanner 2, which is the beginning of puberty. Then stages became more advanced up to stage 5, in which there is nipple projection and mature areola that's fused with the breast contour. The pubic hair as in adult quality of hair extending to thighs with feminine distribution. You have to be careful during assessment of puberty if there is delayed first signs of puberty up to 13 years of age in girls and 14 in boys. Also, if there is early signs of puberty before 8 years of age in girls and 9 years in boys. By this, we came to the end of this lecture. Thank you for listening. I'll be glad to answer your questions in the face-to-face session. So till then, be ready.